Welcome back to my YouTube channel. We are very excited. We have got 6 followers since I last posted, so the running information is getting out there. Now, if you don't know who I am, my name is Blake. I'm mainly sports podiatrist. I work and lecture at the University of Newcastle. I run myself. I work with lots of runners, and the specialty that I kind of see in the clinic is running injuries. So as a result of that, I do lots and lots of return to run programs, and people come to see me a lot to work out a good running program. And that's what we're going to talk about today. How do we get from doing a certain amount of running, and that might be, a couple of kilometers, it might be no running, we might be returning from an injury, all the way back to where we want to get to, which can be anywhere from a 5K, a 10K, a half marathon to a marathon. Now, the programming itself for all of that really does take a long time, and I'm going to speak about the first part, which is how do we get back to some consistent running and be able to tolerate at least 60 minutes of running. There's so much crap out there, just running advice, running education. There's some running plans that like Catch the 5K. I know Runner do some plans, and they're not very good because they don't explain the nuances and the true understanding and principles of returning someone to running. You can't just say for every single person, you do this amount and you slowly increase this much, and then you will get to the end of the 12 weeks and you'll be okay. There's factors where we can subcategorize people and populations, and for some people, they just need to take a lot longer. They might need to take double the time, and there's other people that might be able to do it in half the time, but it's very hard to identify. So what we need to be able to do is find a sweet spot or a middle ground for people, which we're going to talk about today, and you're going to be able to work out what kind of category you're in. I'm going to have a PDF attached to this with the categories plus the Return to Run program, but you have to watch the whole video. If you're expecting to have a good quality return to run and understanding in a couple of minutes, then you're an idiot, because it's just not gonna happen. You need to be able to know where you sit on this continuum so you can figure out how long it's gonna take you and what's gonna be the best path forward. Returning to running is challenging. What you need to be able to do is you need to try and work out how much can your body currently tolerate and how much do we need it to be able to tolerate. So there's always going to be a discrepancy through there. So different tissues adapt at different times. We've got muscles, tendons, bones, cartilage, you've even got your skin as another part of your body system, and they all adapt at different time points. So some tissues can adapt very quickly, like a muscle. Other tissues can take a really long time, like a bone. So we need to be aware of that. And unfortunately, we can't know exactly for each person, and really for each tissue, how long it's going to take to be able to tolerate that running. So as I said, we need to find that sweet spot in the middle to give the body time to adapt. Now, if you're thinking, your body's probably going to be okay and you maybe not get injured, or you maybe had an injury in the past and you're back and everything's going okay, we have to look to the research to unfortunately go through the facts. So at least 1 out of every 2 runners will get injured in a period of 12 months, and up to 79% of runners will get injured within 6 months. Now, I've tagged the research just here and here. That's a lot. And we think the big reason for that, amongst many, is that the load that we're trying to tolerate, the tissues just don't have that capacity to handle that. So again, we need to go slow, we need to go gradual, and we need to use the principles in this video, which I'm going to be able to explain to you, to be able to get back to that. So principle 1, why do return to run programs fail? As I was saying before, tissues adapt at different time points. If I go into the gym right now and I lift and I do a bicep curl, my muscle is going to adapt a lot quicker than what my tendon does, although the loading is going to be relatively the same. So we have to be aware that we really have to go as slow as our slowest tissue. So when we think of the lower limb, that's going to be bones and joints and tendons. The analogy that I want you to think about for all of your running goals is, think of your body a little bit like a cup or a bucket. And that's how much you can handle. That's how much stress your body can handle. Now, if I pour water into that bucket, the water is going to represent the load and the stress coming into the body. So this is how much I can handle. This is the load coming into there. The goal for us is to try and build a bigger bucket so we can tolerate more stress. And that happens by doing more running. But remember how we're saying the bucket only gets bigger so quickly. So we need to be able to control how much goes in and let the bucket adapt. Now, for some people, they just start with a bigger bucket, and we're going to talk about the principles and the people that are more likely to fit in that category. And other people that haven't done a lot of sport, or running, they might have a smaller bucket, so we need to go a little bit slower. So the thing that's going to be the easiest to control is how much load and stress and how much water comes into that bucket. Now, the program that I've got below goes for 13 weeks, and there's a couple of principles which are going to be detailed in the program, but I'm going to explain it here. We want to have at least a day off in the middle from running itself. Now, that doesn't mean no activity at all. You can cross train, you can walk, you can swim, you can get on the bike, but we're really trying to control the stress through the lower limb to let it to be able to recover. So when we look at a week, it's going to be around 3 runs per week. So it might look like Monday, Wednesday, Friday. It can look like Tuesday, Thursday, Saturday, and that's timing and trying to give that body a chance to adapt. One of the biggest mistakes that I see, people just run too quickly when they start. So remember, tissue tolerance is what we're trying to build at the start. We're really not trying to build that much fitness. That'll come later. And if you're new to running, you're going to be building fitness quite quickly. Just like when you start in the gym for the first time, you know, we see novice lifters build muscle really quickly, advanced lifters not so much. So it's the same with running. So don't stress too much about your fitness. We're really just focused on the tissue. So for the first 4 weeks, we have a general rule of you keep it flat and you keep it easy. So flat means no up and down hill. That's going to make it a little bit harder on the tissue, make it a bit harder on the cardiovascular system, and keeping it easy. Now that's going to be different for everyone. A really simple metric to use is just your heart rate. So if you wear a watch, you know, if you're able to have a conversation while you're running, that means that it's pretty easy. So you want to keep it as easy as possible, and the easier the better. And you'll see for the first week of the running program, you're actually just walking to start with to get an idea of how it should feel. Obviously, jogging is going to be harder than walking, but it shouldn't be that much harder. You don't want to be getting through a run and it's really challenging, you're really heavily breathing, or you're feeling as though you're finished and you just want to sit on the lounge or you're really tired. So some of the principles that we use when we're starting running for the first time or returning someone to run, I've detailed them out here. I've already mentioned some of them: frequency, having rest. We've got some cross training in through there, which is going to help the tissues adapt and be able to recover, but also increase your fitness. And that's a good example to think of your aerobic fitness, and we'll just generally call it that, versus your tissue fitness or capacity. As I said, your bones are very slow to move on the adaptation curve, whereas your aerobic fitness will move quite quickly. So you might start, week 2 and get to week 5 and you feel a lot fitter, but your bones and your tendons, they haven't moved a lot. So you can feel a lot better. And if you're feeling better, you can obviously run a little bit quicker as long as we're staying in that metric. It might be a heart rate of, you keep it under 140, or you are able to have a conversation with whoever you're running with. The other principle is footwear. I talk a lot about shoes. I work with some of the companies and I give feedback to them. I've got some other videos on this channel about shoes. Honestly, it really doesn't matter that much. The goal is for you to get out and do more running as pain-free as possible and injury-free. So if you get a shoe and it's comfortable and it's not a minimal shoe or a barefoot shoe, you're probably going to be in the right category. And because we're not doing much to start with, it doesn't matter too much. I mean, at the start in the first couple of weeks, you're doing anywhere from 5 to 10 minutes of running and mostly walking. So shoe choice doesn't matter too much. That'll matter more towards the end. So don't stress over that. Another principle I really like, which is challenging in this part of the return to run, is just to make it social. Run with a friend or someone in your family. Maybe you go out together and you do your runs, and then you turn around after a minute, run 30 seconds, run 30 seconds back. It just makes it a little bit more enjoyable, and you're not thinking too much about how the body's feeling. You're more enjoying being out with someone. A really common scenario for people is they get some pain or an awareness. Now, I'm a medical practitioner. I work with thousands of people in pain and some asymptomatic as well. I can't give medical advice, and this video isn't a medical advice education video for people to be able to follow. But if you generally have some soreness in your muscles and not over a bone, and it's going away within a couple of days, we probably expect that because you're doing something new that your body hasn't done either for a while or ever before. So the general rule is, if you're finding that the discomfort stops you for a week, you have pain over a bone, my advice is always to go and see someone. If you see a good practitioner, and I do online consults for people as well, but if you see a good practitioner, they should be pretty clear to say, great, it's nothing nasty, modify for a couple of weeks and then we'll get back to normal. Or they might say, yep, that's fine, that's just a muscle soreness, you're fine to continue running. Our other principle is, when do we go slower? So as I said at the start of the video, some people may take double the amount of time, and we've got somewhat of an understanding who's going to fit into that category. So certainly if you've had a previous injury in the lower limb, we clearly know from the research, if you've had a previous injury, your risk of having that injury again or an injury somewhere else in the body is a little bit higher. So if you've had a sore knee, an Achilles tendinopathy, a glute tendinopathy, patellofemoral pain, plantar fasciitis, I am saying that you are more likely to have that condition again, and that's what the research tells us. So it makes theoretical sense that you should take a little bit longer just to give that tissue some time to adapt. Now, I can't guarantee that, and there is all the chance that you could return to run a lot quicker than that, but it's very hard to gauge, and we don't have any way to understand who's going to fit into the quicker or the slower category. So we are hamstrung and we have to go a little bit slower. If you've played a lot of sport that's multi-directional when you were younger, and you've played a lot of different activities into your 20s and 30s and 40s, depending on how old you are, we've got a pretty good idea to think that your tissues probably are a little bit stronger than most people, compared to if you haven't done anything when you're younger. You might have just done low impact activities like swimming, you may have done any running, you may not have gone into the gym, and you didn't play any sport when you were younger. So during those pivotal development years, we think that the tissues may not have moved a lot further away from that kind of weakness. So we think that you may need to take a little bit longer. And if you've got some systemic health factors that are affecting your body, we know as a risk factor if you have a high BMI, waist girth, and it's not just because you're carrying more load, there can be some systemic health, maybe more prone to having an inflammatory reaction happen. And that's a real hard one that I'm not going to talk about in this video, because that really needs to be looked at a medical practitioner. So broadly speaking, previous injury, if you've had a history of lots of low impact activities like swimming, horse riding, or you haven't played a lot of sport, and you have some other systemic health factors, and that can be nutritional things like relative energy deficiency in sport, a higher BMI, there is no harm in taking double the amount of time. And I've actually written that into the program. So you might do week 1, repeat that again, and then move to week 2. And that might take you, as I said, 6 months, but it's going to be well worth it. Now, all people know their bodies better than anybody else. So if you're someone where you feel as though you are a little bit more injury prone, you've tried to do more activities and things just haven't gone very well, or you've run into injuries or problems or pain, I think that it's a lot safer for you to fit into that second category where you repeat each week and just take a little bit longer to get back. Now, running technique is really like shoes. It doesn't matter very much in the start. Run how you feel most comfortable. Remember, you're only doing a little small amount. Make sure when you are running, you're thinking about your breathing, where you're landing, and trying to get an idea of a feel for what's happening within the body. If the knee's a little bit sore or the ankle's a little bit sore, that's okay, that's expected. To have some aches and things here and there, as we said, is normal, and we expect that to happen probably over the 12 weeks. Of course, towards the back end, it's going to be feeling it a little bit better. As I said, if it lasts more than a week, or it really is stopping you from running, then you really should go and see someone. If you're waking up within 24 hours and 48 hours that are completely recovered, it's probably just your body getting used to some new loads. If there's anything that I want you to take from this video, and I know there's a lot of information, it really is the understanding that your body at the moment, if you haven't run or you're returning to running, its capacity to handle running is a lot less. Now, that doesn't mean that you can't go out and run 20, 30, 40 minutes straight, but it is a lot safer because we know your tissues take time to adapt. And again, some tissues are slower than others. It's a lot safer to do a little bit of activity, let your body recover and adapt, do a little bit more, a little bit more, a little bit more. And we know clearly about everything in the human body, it needs to go that way. We're slowly increasing the doses. And I love to use the medication analogy. If I was to give you, say, some Panadol, let's say we're trying to figure out your maximum safe dosage, it's a lot safer for me to start at a lower dosage and slowly increase. If I say, here's 6 tablets of Panadol, let's just see how you go, probably not a good idea. But if I say, here's half a tablet, let's see how the body goes, here's 1, here's 1.5, here's 2, it makes it a lot more sense. So you need to think exactly like that with the running, use the medication, use the bucket analogy. We're trying to build a bigger bucket, and we know that it takes time. And there isn't anything on earth that we know yet. Certainly I'm not aware of it. If you know something, please let me know. We don't know anything yet that makes the body adapt quicker. Of course, sleeping, nutrition, potentially some other forms of cross-training can help, but your bone can only adapt so quick. Your tendon can only adapt so quick, similar to your joint as well. So go slow. And the goal is that we can build you to be a sustainable runner. It means that in the long term, you're going to be able to do more running. If we go too quickly and we end up with pain or an injury, you're going to have some time off. And we see constantly, it's probably the most common thing that I see, is people that have tried and gone too quickly. They run into some problems. They try to manage it themselves. It doesn't get better. And they end up having another 4 or 5 or sometimes 6 months off of trying to get back because they've gone too hard at the start. Now, as I said throughout the video, this is not not medical advice. This is educational purposes only. I do online consults. There's lots of good practitioners. If you need some help, you can reach out to me and we can work out a plan. You should feel like you've got a good understanding. So happy running.